Hi, my name is Matt.
And I'm Margaret.
Margaret and I were part of a consumer group for this Brain Summit. The areas identified by us as significant can be grouped into three themes:
Communication, coordination and collaboration. The biggest priority for people with brain cancer is communication.
We think the important ideas to promote good communication are: allocate some time for this conversation, take time to find out how we like our information, make sure we have someone with us when you tell us our diagnosis, support conversation with written resources, question prompt, lists and diagrams, give us another opportunity to hear information and ask questions. As we mentioned at the start, our three themes affect each other. Communication can impact the coordination of treatment and care for consumers. It's the coordination you are talking about, diagnosis in the acute system. I was talking to neurologists and they could not give me any information because you have to go to the oncologist, who you don't meet for however long when you get out of hospital, who can actually tell you if you need chemo. We want to know what is going to happen and in what time frame it will happen. Who is the person or team coordinating our care? We also want to know who to talk to if we have questions or if something is not happening.
It's about having the treatment plan communicated in a clear way, with some written information to back it up. So when we walk out the door, we have something to help us remember what's going on and how we're going to navigate the health system. Some consumer group feedback on navigation was: it's a clunky service delivery between private and public systems, and then between metropolitan treatment centres and our regional homes. We think the important areas to improve communication for better coordination are finding information, finding services, connecting with other services for help, like occupational and speech therapy.
The consumer group felt strongly that a clear treatment plan helps us to have a sense of control and to be an active part of the team. This brings us to our final area of collaboration. Communication and coordination can affect our ability as consumers to collaborate with our medical teams on our treatment.
This is about more than us as patients. It's about us as people, our families and loved ones, and everyone who helps, advises and supports us. It works better when we are a team that includes all of us, not just some of us.
It really depends a lot on the carer for the medication side of things. When my wife left the hospital, she was given this plastic bag of medications. I gave it a bit of thought and came up with a spreadsheet that reflected the changes in medication and the need to keep adjusting the plan. For example, Dexadose changed.
It's so important to make sure that someone is monitoring all of this.
To summarise our recommendations, ask us about what we want to hear and make changes to your way of giving us the information. Understand that many of these conversations are important moments in our lives and give us some time. Let us ask questions, give us straight answers or point us in the direction of people who can. Find a better way to share information between health services, private to public or metro to regional.
Thank you for your time today. We hope our presentation assists you in working together to prioritise variation for brain cancer care.